Good evening, ladies and gentlemen, and welcome to Meet Touchstone Essentials Live Product Training Edition. We're excited to have you here, and we've got Cindy Klement here again with us. And as you know, Cindy is an expert in this industry. I want to make sure you know about her book, Your Body's Environmental Chemical Burden. It's got all kinds of awards, and it's an excellent book. Cindy, as you can see on the left-hand side of the screen, acclaimed speaker, published author, nutritionist, herbalist, adjunct professor, you name it. She's got the accolades, and she teaches doctors all about nutrition along with everybody else that she knows. We're excited about that, and we have her here to teach us about the cardiovascular system tonight. We're excited about that and what we can learn, and Touchstone Essentials has some excellent products for the cardiovascular system. Cindy, thank you for being here and sharing your knowledge with us tonight.
My pleasure, and thank you for the introduction, Craig. You're always so kind. Traditionally, February is considered Heart Health Month, and with Valentine's Day coming up so soon, I thought it would be an appropriate time to explore that cardiovascular system. So let's get started, folks. Did you know that heart disease is the leading cause of death in the United States, and that in the US, someone has a heart attack every 36 seconds? Every year, about 805,000 plus or minus people have a heart attack. And in 2019, there were 380,000 people that died of coronary artery disease. So let's learn a little bit about that cardiovascular system and what we can do to keep it healthy. The cardiovascular system consists of the heart, which is the cardio, and then the veins and arteries known as the blood vessels, which is the vascular. So here we go. We've got cardiovascular. In one day, our blood travels nearly 12,000 miles throughout our body, because the blood vessels themselves have an incredible, if we lined them all up, they would be 60,000 miles long. And the average blood cell makes a round trip through the body and arteries every 60 seconds, hitting speeds up to 10 miles per hour. And that 5 to 6 quarts of blood in our body travels through those blood vessels, equating to about 2,000 gallons per day. So it is a very busy body system. Now, the heart itself is an organ which is the size of our fist. It weighs about 11 ounces, and it has 4 chambers in the heart. The 2 upper chambers are what receive that incoming blood, whereas the 2 bottom chambers pump the blood out of the heart. And these chambers are made of muscle, and they're powered by electrical impulses. So our brain and our nervous system are what direct the heart's functioning. And this, once again, to me, is an example of how all of our body systems work together, and how the health of one system can affect the health of another system. So basically, the heart is a pump. It beats anywhere from about 60 to 100 times a minute. And with each beat, that heart sends the blood throughout our bodies and carries oxygen to every cell. And then after delivering that oxygen, the blood returns back to the heart, which then sends that deoxygenated blood to the lungs to pick up more of that oxygen. Now, the arteries are these very thick muscular vessels, and they are what carry that oxygen-rich blood from the heart to the cells and the tissues of the body. And because these arteries transport under such high pressure from that heart beating, they have walls that are much more elastic than the veins. And these, as the blood as the force of the blood pressure and the heart, as it beats, these arteries pulsate as the blood pumps into them. And each of these arteries are, think of it as a muscular tube, and they're lined with 3 different layers of smooth tissue The innermost layer is called the endothelium, and that is what forms a barrier between the vessels and the tissue, and it controls the flow of substances and fluids in and out of that tissue. And then the middle layer is what lets those arteries handle that high blood pressure from the heart, that high pressure from the heart. Whereas that outermost layer is more of like a connective tissue that anchors those arteries to that nearby tissue. And like the respiratory system that we talked about previously, where we have the trachea, which branches off to a bronchus, which branches off to a bronchiole, which branches off again into the alveolar sac, each one getting smaller and smaller. That's what happens with the vascular system because the vessels branch off into smaller and smaller parts. So we've got the arteries, but then the arterioles are smaller in diameter and they have very thin muscular walls and they branch out from the artery and they lead then to even the smaller capillaries, and they are the smallest of all the blood vessels. Their walls are only 1 cell thick, much like that alveolar sac, and that enables that interchange of water and oxygen, carbon dioxide, nutrients, and waste products from the blood and the surrounding tissues. Now, the veins, as you look at the veins, these are vessels that transport the deoxygenated blood or the oxygen poor blood and the waste products back to the heart. The blood in the veins moves much more slowly because it's under low pressure. It doesn't have that heart beating into the artery. Now, the venules are even the smaller ones, and they drain that deoxygenated blood from the capillary beds and return it to the veins. Now, there is a codependent relationship between the kidneys and the heart. And in this image, what you can see is that main red artery branching off the aortic artery, and it connects directly to each of the kidneys. And these are called the renal arteries, and renal just means kidney. So these renal arteries are part of the cardiovascular system, and they carry about 1/2 cup of blood to each of our kidneys every minute in order to clean the blood and remove the waste and the excess water. And if the kidneys can no longer do this job, this is when the patient must be on dialysis. So, what many people don't realize is that when the health of the heart is affected, so too are the kidneys. The kidneys also help to control our blood pressure and balance the different minerals in our body, like sodium and potassium and phosphorus. And without the help of the kidneys, the heart would be working too hard and simply could not function. So again, it's important to know that having kidney disease can directly affect your chances of developing heart disease. And having heart disease can directly affect your chances of developing kidney disease. So, it's important to take care of all body systems. Now, the risk factors for heart disease, of course, include high blood pressure, elevated cholesterol, diabetes, being overweight or obese. And I must add genetics to that list because genetic factors can play a role in blood pressure and heart disease and other related conditions. In 2019, the Journal of the American College of Cardiology published research indicating that over 30% of heart disease cases are caused by genetic factors. Whoops, went too fast there. I'm still talking about this one. So the risk of heart disease can increase even more when heredity combines with unhealthy lifestyle choices, such as smoking cigarettes. You see, tobacco use increases our risk of heart disease because that smoking damages the heart and the blood vessels and increases our risk of arterial sclerosis or a heart attack. Whereas nicotine raises the blood pressure and the carbon monoxide from cigarette smoke reduces the amount of oxygen that our blood can carry. So even for non-smokers, exposure to secondhand smoke can increase our risk for heart disease. And of course, there are other lifestyle factors that also influence our risk, such as an unhealthy diet, physical inactivity, and excessive alcohol consumption. So let's talk a little bit about that diet. If we're eating a diet that's high in saturated fats or trans fats or cholesterol, of course, that's been linked to heart disease and even atherosclerosis, which is when these plaques, these kind of clumps of fatty material accumulate on the inner walls of the arteries. And another thing, like too much sodium can increase our blood pressure, and drinking too much alcohol can also raise our blood pressure and increase our risk of heart disease. But alcohol can also increase our triglycerides, which are a fatty substance in the blood, increasing our risk for heart disease. So how much is too much when it comes to alcohol? Well, no more than 2 drinks if you're male, or 1 if you're female. And what is considered 1 drink? 12 ounces of beer a day, or 5 ounces of wine a day, or 1.5 ounces, which is pretty much 3 tablespoons of hard alcohol. So, cutting back on alcohol is certainly helpful. But lastly, not getting enough physical activity can lead to heart disease, meaning that regular physical activity can lower your risk, as can getting the right kinds of superfoods. For instance, Essentials contains vitamins from plants that support our heart health. It also contains the antioxidant resveratrol from grapes. It contains essential fatty acids from acai and mangoes, and polyphenols from green tea, all of which support cardiovascular health. According to Mayo Clinic, resveratrol might help prevent damage to the blood vessels, prevent blood clots, and reduce what's called the bad cholesterol, or the LDL, the low density lipoprotein. Whereas the essential fatty acids in essentials can help reduce oxidative stress and lower levels of that LDL cholesterol. And you may recall from our webinar on antioxidants that the term oxidative stress is nothing more than the imbalance between free radicals in our body and the antioxidants which neutralize them. Now, the polyphenols are micronutrients that naturally occur in plants. There are more than 8,000 types of polyphenols. So the polyphenols found in green tea can protect the body's tissue against oxidative stress, coronary heart disease, cancer, and inflammation. But polyphenols also help to improve that inner lining of the heart and the blood vessels, that endothelium. They can help raise the good cholesterol, lower the bad cholesterol, and polyphenols can help to promote an anti-inflammatory or antiplatelet activity. And antiplatelets are what stop the blood cells from sticking together and forming a clot. Whereas Wellspring also supports healthy cholesterol levels because of its alpha lipoic acid content. It also supports heart health with its phytosterols, which are linoleic and oleic acid. But phytosterols are compounds, and this is how they work. They lower cholesterol by reducing cholesterol absorption in the body. Now, Harvard University has written that linoleic acid reduces the bad cholesterol, and there's even some evidence that it improves insulin sensitivity and blood pressure. The oleic acid improves heart conditions by reducing inflammation and lowering cholesterol. So Wellspring and Essential are amazing for really keeping track of our heart and keeping us heart healthy. But what about toxins? Do they affect heart health? Well, My work has found research that shows a correlation between volatile organic compounds, those VOCs, those things that have really quite a smell, like paints and adhesives and gasoline and exhaust. Think of things that really have a very strong odor. There is a correlation between VOC exposure and cardiovascular complications, and some research suggests that high levels of occupational exposure to VOCs can also affect blood pressure and heart rate. There are also recent studies that show that pesticides are consistently and strongly associated with cardiovascular disease, including dyslipidemia, which, remember, just means that the lipids or fats are reversed. So dyslipidemia means your good cholesterol is now too low and the bad cholesterol is too high. So these pesticides have been strongly associated with dyslipidemia, with elevated triglycerides, and they can also cause heart muscle deterioration. It's also been demonstrated that workers who are occupationally exposed to pesticides can increase their risk of arterial sclerosis, high blood pressure, and something called peripheral arterial disease. Now, it's also known as PAD. Peripheral, if you've seen it on commercials or something, but peripheral arterial disease is when these fatty deposits and calcium build up in the walls of the arteries, and that results in a narrowing or blockage of the vessels that carry blood from the heart to the legs. Researchers are also finding increasing evidence correlating PCB exposure with obesity, the incidence of type 2 diabetes, metabolic syndrome, and cardiovascular disease. And remember, obesity and type 2 diabetes are already risk factors in and of themselves. Now, studies have also indicated that BPA can be a causal effect of cardiovascular disease and liver enzyme abnormalities. And triclosan, which is an antimicrobial, they use it in a lot of things like sponges and toothbrushes and, oh my goodness, just all over the place. But triclosan's effect on the gut microbiome has attracted the attention of research due to its correlation to cardiovascular disease. So the answer is yes, toxicants can affect our cardiovascular health. And toxins, folks, are all around us every day. We battle them constantly. There are anywhere between 80,000 and 100,000 chemicals in our environment, and they certainly damage our health. Zeolite is a natural mineral with a rare negative charge, and many of these heavy metals and toxicants have a positive charge. So if the zeolite comes in close proximity, it will attract the toxin, it will bind it and remove it from the body. So luckily for us, in just 30 seconds a day, we can help rid the body of these heavy metals and toxins and thus experience improved energy and well-being. But let's take a quick look at what's called the endocannabinoid system. It was discovered about 30 years ago at the Hebrew University in Jerusalem. And I want you to simply think of it as the master regulator of all of our body systems. Because when we're challenged by an injury or bacteria or viruses or stress or toxins, the job of our endocannabinoid system is to help us get back to normal. And it's a state in our body known as homeostasis. Now, to date, 2 cannabinoid receptors have been identified. They're CB1 and CB2. Both CB1 and CB2 receptors are present in the heart. And CBD oil has been shown to exert a beneficial effect on the cardiovascular system. In the Journal of the American Heart Association, they have stated that areas of promise include CB1's anti-inflammatory effect and CB2's ability to reduce plaque size and inhibit the action of oxidized LDL. Now, in the article CBD for heart disease, they state that CBD's anti-inflammatory and antioxidant properties may be able to reduce risk factors that lead to heart disease, things like high blood pressure. And it may also be able to reduce the risk of related conditions such as stroke. So, good news for us, because when we use CBD products on a daily basis, we can feed and support our endocannabinoid system to balance not only our cardiovascular system, but every body system. Touchstone Essentials CBD oil is organic. There were no solvents used in its processing. There are no artificial ingredients. They're fast acting, they're highly absorbable, and they're non-genetically modified. So let's talk a little bit about the benefits of exercise. Actually, the list is quite long, but exercise can help improve your chances of living longer and healthier. Exercise can help relieve the symptoms of depression, improve your mood, and improve your sleep. Exercise can help protect you from developing heart disease and stroke and some of its precursors, like high blood pressure. Exercise can help protect you from developing certain cancers, including colon and breast cancer. It can help to prevent type 2 diabetes and metabolic syndrome. Exercise can help prevent osteoporosis. It can help prevent weight gain. It can promote weight loss and help keep the weight off after weight loss. Exercise, it can also improve heart, lung, and muscle fitness, really among so many other benefits. So my question to you, if you're not exercising, is what is stopping you? Is it you? Is it you that's stopping you? Maybe you're telling yourself, oh, I don't have anywhere to exercise. I don't have enough time. I have no self-motivation. I think exercise is boring. I don't find it enjoyable. Maybe you're afraid of being injured, or maybe you've been injured recently. So you have to ask yourself, what is the best type of exercise? And really the answer is, it's the one that you'll do. So make sure that you find something that you enjoy and then just do it. Remember, it takes about 2 months for a new behavior to become automatic, but it can take as little as 18 days to form a new habit. So maybe you need a little bit more energy and stamina to embark on your new exercise regime, and we've got you covered. Super Green Juice has 44 of the world's healthiest organic superfoods. And what that'll help you do is reset your metabolism, cleanse your system, and give you that sustained energy that you're looking for throughout the day. Super Green Juice also contains omega-3 fatty acids, which have been shown to significantly reduce the risk of sudden death caused by cardiac arrhythmias in patients with known coronary heart disease. But omega-3 fatty acids are also used to treat hyperlipidemia and hypertension. So hyperlipidemia, remember, lipidemia are just the cholesterols in your body. Hyper would be very high lipids in the body, whereas hypertension is that high blood pressure. But also, fiber is a known way to support cardiovascular health, because it can help to provide that fiber that we need, that 3 grams of fiber every day to give us that good cholesterol level that we need. And Super Green Juice can support that for you. Whereas in the organic super protein, the medium chain triglycerides from coconut in that product, in the organic super protein, gives you that lasting energy and support for your metabolism. These medium chain triglycerides, also they're called MCTs, they help to create a feeling of fullness, so you're not craving unhealthy foods. And in addition to the MCTs, the branch chain amino acids support the growth of muscle and fight off that workout fatigue that you might be experiencing. Boost focus fuel also helps to curb cravings and boost your metabolism and increase your energy. Now, green energy, it's a wonderfully unique blend of botanicals. And what they do is they optimize your oxygen flow and they infuse your body with natural energy, because when your red blood cells are energized with oxygen, you won't feel fatigued. You won't have that post-meal sluggishness, and you will be able to perform at your peak first thing in the morning and well into the night. Green energy doesn't mask the exhaustion or fatigue in your body. It just gets to the root cause and promotes that natural energy by optimizing that oxygen flow. So let's get moving. Lastly, water is the main component of blood, and it's essential for carrying nutrients to the cells and taking away waste products. And if your body is short on fluids, one of the first signs is feeling fatigued. And if you keep your body hydrated, it's going to help your heart more easily pump the blood through the vessels and to the muscles, while keeping those muscles working efficiently with that extra oxygen. So if you're well hydrated, your heart doesn't have to work so hard. So that concludes tonight's presentation, folks. I thank you so much for spending time with us. We look forward to having you back here on February 24th, when we're going to be talking about how to achieve healthy skin. So happy Valentine's Day. Back to you, Craig.
Thank you, Cindy. That was wonderful. Hey, can I ask you a question? I noticed that that we often go back to CBD with every conversation, right? And also zeolite.
That's right.
The exciting thing is you can use them to help with everything.
That's right.
Any comment on that?
Well, it's just the endocannabinoid system is such an important system. It really is. It's the master of our body. And so we have, no matter which body system we talk about, we have to balance that. We have to keep that body system supported. And that's why no matter what we talk about, we have to include CBD. That has to be taken on a daily basis to keep that homeostasis, to keep that body, that endocannabinoid system fed and supported, because it supports all of the other body systems. So you're right, every seminar when we talk about the bodies, we always include that. And as far as the zeolites, because there are so many chemicals in our life. I mean, they are in everything we rub on our skin, everything we wash our clothes in, every chemical we clean our house with, the air that we breathe, the food that we eat, the cars that we drive. I mean, it's crazy. And so, yes, all of this research, it was so much fun when I was writing that book. Way back in let's say, the 90s, there were no studies done on the body, on the body burden, as we call it. And yet today there are hundreds of thousands of studies done every year, because everybody knows what a toxic environment we're in. And there's some of these chemicals, Craig, they're forever chemicals. They will never leave our bodies. They will never leave the planet. And so we are exposed on a daily basis. And when you think about it, one of the upcoming webinars I'd like to present is prenatal planning, because the average baby being born, and this was 15 years ago. They haven't repeated the study, but 15. So I can only imagine that it's worse, because 15 years ago, the average baby coming into this world, brand new baby out of the womb, had 287 toxicants in its umbilical cord blood. And that was just the beginning. Just think about it. They came into the world. Now, I didn't come into the world with that. You didn't either. I was born in 1952. We didn't have that many chemicals. And as we grew older, there were more and more chemicals that were around, but they really exploded in the 50s and 60s. So I didn't have that prenatal dose. And that's why so many kids today are just have so many health problems. there's too many toxins. So
Yeah.
CBD and zeolite are my two favorite things.
Yeah, I mean, it's just interesting to notice. It's interesting to notice just how important they are,
Yes.
right? And they really help in every situation with every condition of the body. I just that just is, it screams out to me every week because every time we get together, because you talk about them all the time. They're important products. So I
Yep.
love that, and thank you for pointing that out. Thank you for being with us. Wonderful evening tonight. Ladies and gentlemen, thanks for being with us. We appreciate you, and we'll see you on the 24th, is it?
Yep.
24th, to learn all about the skin and Touchstone Essentials products for the skin. Take care, everybody. Have a great night.
Good night.
Bye-bye.